My name is Dr. Bob Marnott. As a doctor and a father, I'm working to fix our broken healthcare system here in Vermont and around America. I'm proud to be part of the new Green Mountain Coalition, independent groups all pulling toward a single goal: implement Governor Shumlin's Green Mountain Care plan for publicly funded, universal, affordable healthcare. Why is this important? Out-of-control healthcare costs are the basis of every single fiscal problem our state is facing. Green Mountain Care is the only way to stem the tide of rising property taxes, help teachers get the resources they need, and prevent the staggering 17% increases in healthcare costs our public employees just saw. Most important, get business out of the health insurance business and back to business. Let's help every Vermonter with a publicly financed healthcare plan for all Vermonters. The answer is Green Mountain Care.
There's been a lot of talk about states trying to block the healthcare reform law, but I'm here to tell you about a state that's going full steam ahead in the other direction, and that's Vermont. Vermont lawmakers took action a few days ago to try to control healthcare costs and to guarantee that everyone in the state has access to the care they need. What they did was pass a bill to create a state-run single-payer healthcare system. If things go as planned, in a few years, Vermonters will no longer have to deal with private insurance companies to get basic medical coverage. Vermont plans to get to single payer by using the federal healthcare reform law as a stepping stone. That law requires every state to set up a health insurance exchange, sort of like an online insurance marketplace. By 2014, states must offer at least 2 health plans on their exchanges. Vermont might offer only 2, a state-run plan called Green Mountain Care and a plan operated by a private insurance company. The ultimate goal is that Green Mountain Care will eventually be providing coverage for all Vermonters. The state will then become the single payer of health care. Vermonters essentially will be paying premiums to the state instead of to private insurance companies. You might think this is just one state, and a very small one at that. So what's the big deal? Well, if what happened in Canada is any guide, this could be the beginning of a trend. It started in 1946 in one of Canada's smallest provinces, Saskatchewan. By 1961, all 10 provinces had adopted a similar system. Today, not a single Canadian citizen is uninsured, and Canadians spend far less for their care than we do in the U.S.
I work up here in the governor's office on all of our healthcare reform activities. So it's my job to keep healthcare reform work coordinated across state government and also move forward the governor's agenda to move to a universal coverage system.
My name is Morgan True. I'm a reporter with VT Digger, and my focus is healthcare. People do often think that Vermont has single-payer healthcare because they passed Act 48, but there's still a lot of heavy lifting that needs to be done before anything like that even happens.
There's definitely been some confusion out there in the general public. When we first started talking about healthcare reform right after Act 48 passed, we tried to explain that there was a federal healthcare reform bill called the Affordable Care Act, or Obamacare. Vermont took the step of creating our own insurance exchange because we wanted to ensure that we were designing the system in a way that worked best for Vermonters, and that was a first step that we would be moving forward with in healthcare reform. And as a result, actually, Vermont has the highest per capita enrollment in insurance through our exchange than any other state, which is not a message that has really gotten out there either. But that the governor's long-term goal is to move to a universal coverage system that some people call single payer. The Act 48 names the system Green Moutain Care. Unless you're really paying a lot of attention, I think it's very difficult to keep track of all of the action that's really been happening over the last 3 years.
Hi, I'm Jocelyn. I'm 16 years old and I'm a student at First Colonial.
Thank you, Jocelyn. Do you think that the passing of the Affordable Care Act in 2010 was a good thing?
I think it was because, if everyone has health care, I think it's just generally easier, so they won't have, a lot of bills to be paying later on, and, yeah.
Have you ever heard of Green Mountain Care?
Nope.
Okay, Green Mountain Care is a health reform in Vermont, and it replaces private insurance tied to employment with universal coverage. Do you think that this healthcare reform would ever work in America?
I mean, knowing what our government is today, probably not, but I would use it.
What do you think would be the best form of healthcare in America?
I don't know. Canada seems to have their stuff going right. So, I mean, if we just did what Canada did with their healthcare, then it would probably work. Because, it's Canada and they got their stuff together. So,
thank you.